The University of Alabama, Birmingham had challenges trying to keep up with which of the clinical exam rooms were currently allocated to faculty for seeing patients and which of those exam rooms were unallocated or unassigned. And they oftentimes had a good understanding of what the recurring template would be, but they didn't have a good way to keep up to date with ongoing changes as life happened and a doctor needed to take some time off on a day that they would typically be in clinic using rooms. So it created a lot of challenges for them to have a true up-to-date understanding of which rooms were actually being used or allocated to providers and which could be used by a different provider as needed. UAB approached us with the challenge and let us know that while they had a good understanding of their recurring template for when the rooms would be assigned to which providers, they didn't have a good way to keep up to date with the last minute changes. They looked at the QGenda tool and found that using QGenda, they could allow their providers to more effectively communicate when they would be out and then have that reflected in the list of which rooms were being allocated to which providers. That gave them a much more up-to-date and accurate representation of which rooms were being used and which ones were going to be underutilized if they didn't reassign them. By using QGenda's room management solution, UAB Neurology was able to increase patient visits by 7.4%, clinic session count by 4.7%, all using the same number of providers and the same number of clinic exam rooms. Ultimately, they saw a big increase in provider satisfaction as well as patient access.